For our Experts in Emotion interview, we have the honor of speaking with Dr. Jonathan Rottenberg. A leading researcher in the area of emotion and psychopathology, Jonathan Rottenberg has pioneered efforts to integrate the basic science of emotion with the study of psychopathology. He received his PhD from Stanford University and is currently an associate professor of psychology at the University of South Florida, where he directs the Mood and Emotion Laboratory. He's the lead editor of Emotion and Psychopathology, Bridging Affective and Clinical Science, and he's authored over 30 scientific publications. His work, not surprisingly, focused on depression as well as crying, has received international media coverage, including Science News, Scientific American, The New York Times, ABC News, and the BBC. He also writes a blog about depression for Psychology Today. One fun fact about Jonathan Rottenberg is that he decided in his early 40s he was going to train for a marathon, and by the time we'll speak with him, he'll have already run 3 during that time. So I now turn to our Experts in Emotion interview with Dr. Jonathan Rottenberg, answering the question of, is crying actually good for us? So welcome, John. Thanks for speaking with us today.
Thank you for having me.
What I'd love to hear from you as we get our conversation going today is a little bit about your journey into emotion. So what first got you started and hooked on studying emotion?
Well, I went to graduate school at Stanford, and I was arriving there in the late 90s, and emotion was actually very hot at that moment. It was it's a scholarly topic. There were new theories. There were new journals, like the APA Journal Emotion, coming out. And I had the good fortune of working with James Gross, who's an expert on emotion regulation. And what really excited me was the possibility of combining all of these new methods, physiological methods for studying emotion, new methods for studying emotional behavior, combining these methods with clinical research. Ian Gottlieb was also at Stanford in the late 90s when I was there, and I thought this was an incredible opportunity because here we had these remarkable tools that were increasingly understood as potentially breakthroughs for understanding emotion, and then we also had a clinical disorder, major depressive disorder, which is very much defined by changes in mood and emotion. Only problem was there wasn't very much research. And so I saw this as using new tools as a way to understand in some ways what was the most important part of what I would argue was the most important disorder, in terms of burden, in terms of the degree of recurrence, and just raw prevalence. So I got hooked at that moment, and I've stayed hooked ever since.
And I mean, since you got hooked, I mean, you've just conducted some of the most profound discoveries into really understanding, what is going on in individuals who are suffering from depression, what are the emotional lives of these individuals, and also about the phenomena, that may be particularly prevalent in individuals who are depressed, but is actually something really common to all of us, which is crying. And so I'd love to start out asking you some questions about your research. First with the topic of crying. So we can all, readily recall times in our own lives when we were crying, and many of us seem to have these beliefs that when we've cried, in some way this has been beneficial for us. In some way it's been cathartic or helpful to kind of cleanse us of our negative emotional experiences. But your work is really, really exciting here, in that it suggests that actually that belief may not always be true, and that crying is not necessarily and always adaptive for us. So I was wondering if you could share some of your own scientific observations and findings that sort of now provide a roadmap for helping us understand when crying is and is not necessarily beneficial or adaptive.
Sure. I mean, crying is one of the most dramatic emotional behaviors from when we first start out as little babies to the end of life, and it spreads through that whole life course. And one thing that is particularly salient about crying is that it has a distinctive, socially salient signal, namely tears. And so we certainly notice when we cry. Other people certainly notice when we cry. And so many people have strong opinions about what happens when they cry or when other people cry. And like you said, there is a very strong lay belief that crying is cathartic. And so that is reflected on surveys. When you ask people, do you feel better after you cry? People report yes. And not just being a contrarian, but really wanting to understand to what extent crying is and is not cathartic. We dug a little bit deeper, and so have used a number of different designs, from experimental designs to survey designs to daily diary designs, to try to look at when and where crying might be having benefits, might be cathartic. And what we've discovered over the years is that not all crying episodes are created equal. So what I mean by that is a number of things determine whether or not crying is going to be associated with mood benefits. One is the context in which crying occurs. And some of these findings maybe aren't so surprising, but we just at the end would really want to qualify the idea that when you cry, you feel better, because it turns out that when you look at crying in the moment or crying in these daily diary designs, it's really a distinct minority of the crying episodes that are associated with mood improvement. So the ones that are ones in which the situation really changes as a function of the crying. So social factors. So do people actually come to the side of the person's crying? The crying has this power to draw in others. So those episodes that are drawing in others tend to be associated with mood benefit. Crying episodes in which the situation changes seem to be associated with mood benefits. And finally, the affective state of the crier seems to really make a difference. And this is one connection to depression. Depressed people, it turns out, and people who are very anxious tend not to report that crying benefits their mood tremendously. So, yes, crying, if anything, is associated with mood benefits. Not all crying episodes are created equal, and it seems that both social characteristics and the characteristics of the crier make a big difference in shaping whether or not crying shows any benefit at all.
Well, it's so interesting because you alluded to depression, and when we started our interview, I said, depression for many people is this sort of, quintessential example of, profound crying, right? And so many people think of crying and depression as synonymous, but your experiments really challenge some of these big assumptions about how depression actually alters crying. And so I wonder if you could say a little bit about in what ways does crying behavior provide a window into understanding what might actually be disturbed in depression?
Sure.
Yeah.
And this is sort of a story of being surprised, because when I started out, I thought that our research would confirm what's in the DSM, so the diagnostic manual that's used by clinicians everywhere and researchers, defines part of depression as increased crying behavior. And so I thought what we would be learning is in what ways does depression magnify the crying response. And we wanted to use, again, these new tools of emotion, so multi-method research, studying emotional experience, emotional behavior, and emotion-related physiology, bring depressed people into a lab, compare their crying episodes to those of non-depressed people. And the data didn't really cooperate, because what we found was that contrary to what was in the DSM, depressed people were no more likely to cry to the sad stimulus. And perhaps more interesting, the changes associated with that crying were actually diminished in depressed people. So their physiological responses during crying, like sweat gland activity, were actually less than those of the non-depressed people. And then we started to look at other kinds of changes in other physiological systems, and what we saw mirrored our original analyses, that wherever we looked, depression seemed to shrink rather than magnify the effects of crying. And so this really made me think about what's in the DSM, all of these observations that have come from clinicians over the years. And I doubt that they're simply wrong. It's not that they're wrong, it's that they're making those observations in a particular context. So someone comes in, they're depressed, they're being evaluated, and yes, you see crying behavior, But I think what we've learned in the experimental work is that when you present normative, so the kind of stimuli that makes the average person cry, like this film, The Champ, or this dreadful death scene, a little boy is just ripped apart by this incredible loss. Those kind of normal cry eliciting situations don't do a lot for depressed people. And so what it makes me think is that the things that are eliciting depressed people's crying are likely to be different than what are the things that are eliciting everyone else's crying. And so this notion again of the context really making a big difference. So I'm thinking, well, so depressed people reporting to a clinician that they're having a lot of crying. They may be crying by themselves. They may be crying into their pillow. They may be crying because God or some person isn't helping them. It's not that there are particular sad things in their environment that are prompting them crying. They don't even need necessarily a provocation. So that gives us sort of a different understanding of what the statements in the DSM might mean and what the changes in emotion that depressed people experience might reflect.
I mean, and what you're alluding to is another theme in your work, which really suggests that the emotional nature and lives of individuals with depression are quite different from those who aren't currently depressed or maybe don't have a history of being depressed. And I think you've found that the emotions that these individuals experience with depression don't quite fit their current environmental context, which you would refer to as this emotion, context, and sensitivity. And I wonder what you see as some of the most promising discoveries from this model you've developed that might help us better understand the nature of emotion in depression.
Sure. So I've been talking about this emotion context sensitivity since about 2005. And since that time, there have been other researchers who've replicated this finding, which is essentially that depressed people don't report and display the normative changes that you would expect to see, whether it's positive emotions or situations or negative emotions or situations. That depressed people are presenting this flattened profile of response or this stereotypy. So I think that's at this point we can say that that's real, that we found it in enough studies and consistently across labs. And so we're really looking at a new set of next questions, which is, what is this really about? What does this reflect? What are the proximal mechanisms, whether they're cognitive mechanisms, patterns of thought, whether they're behavioral mechanisms, whether they're physiological mechanisms that explain this pattern, that generate this pattern. In a second key set of questions, I think, it also speaks to the meaning of this pattern is, what is its relationship to the clinical symptoms that you see in depression? So depression is an episodic disorder. So to be diagnosed, you need to have at least 5 of 9 symptoms. And people typically will be in episode for some months at a time, and then they get better and will have lull periods. And so we see this pattern of UCI during depressive episodes. Now, people have looked. I've not seen very often that it's there after the depressive episodes in people who are clinically well. Now, we're studying children, and one of our aims is to understand whether the CCI pattern might be an antecedent to depression. Essentially, what we're trying to understand or unpack is whether these changes in emotion might have some causal relationship to the clinical syndrome of depression. It's possible that they're actually not important in causation of episodes of depression, but they might be more important in the maintenance of depression, that is, how long depression lasts. So we found that the extent to which a person shows the CCI pattern seems to predict the duration of the episode. So this suggests that even if it's not a causal in explaining why a person becomes depressed in the first place, it might be quite important in terms of how quickly the depression gets resolved. And so I think there are some potential implications for both understanding treatments, how existing treatments work, refining those treatments, and incorporating emotion into our conceptualization of treatment, which I think is another huge area of opportunity.
Yeah, that was when you were talking. I mean, it makes you wonder how much you can translate these really promising findings into aiding issues such as you alluded to treatment or differential diagnosis or identifying people who would benefit from, different types of emotion-related interventions.
Yeah, I think there's a lot of opportunity there. And there are some work by people like Andy DeMarkin, which I think is very important first steps is to even understand how do existing treatments that are reasonably robust and successful, how do those treatments change emotion? And so simply pre and post designs where you have people tested on different aspects of their emotional functioning in episode prior to the initiation of treatment, then the same people tested when the treatment was successful, although it would be quite interesting to compare emotion and between those who are successfully and not successfully treated, because right now I think we mostly have assumptions about how treatments for depression change emotion experience, behavior, emotion-related physiology in different contexts. But we don't have as much data as you might think, and part of it is because people who do drug trials and people who do basic research are often different people, and they're very protective of the patients who are in the drug trials. And these assessments of emotion be sort of seen as monkeying around in their trials. But both from a treatment development perspective and a basic science perspective, I think it's absolutely essential to understand just descriptively. I mean, this is not even getting to the question that you're talking about, is using some emotion data as a priori predictor of what kind of treatment a person should get. Should this person get CBT, cognitive behavioral therapy, or should they get antidepressants? If so, what specific brand of antidepressant or specific school within cognitive behavioral therapy? I think ultimately that would be tremendously exciting and important, because what we have right now is a big problem with not knowing a priori what the patient is most likely to respond to. And we have with depression, the good news is a number of different efficacious treatments, but none of them are effective for everyone. They all have a fairly high non-response or incomplete response rates. And so anything we can do to increase the efficiency of treatment, and it seems to me that emotion data would be very high on the list of data that I think would improve efficiency.
I mean, so you touch on some really important themes about where we need to go next, right, in terms of really delineating and mapping out this research to aid and facilitate diagnosis and treatment. When you think broadly about the field of emotion, I know we've talked about crying and depression and emotion and treatment today. Where do you see the field of emotion more generally headed as it sort of moves into the future?
Well, I mean, I think my work is part of a kind of a first wave of integrating basic research, affective science with clinical science. And I think there very much needs to be a second wave. So part of the first wave was saying, we're here, we can do this, but developing more mature and robust and sustainable. So for example, with my own research with ECI, okay, we've definitely shown that there is a pattern, and that it's good to show with robust methods, with multiple methods, that there is a certain pattern. Now we need to go back and go to the next step. And I've mentioned a few of the things that would be involved, but I think this could be true for every different class of disorder. So there's marvelous research going on with emotion and schizophrenia. And I think that, is sort of in some ways a model for where the field needs to go, understanding, for example, individual symptoms in schizophrenia like anhedonia, or inability to experience pleasure, to understand when does that happen, what does that reflect, and ultimately how does it relate to clinical improvement in schizophrenia. So I think that it's a matter of continuing to do what we've been doing. I don't think that I think we're on a good road, but not losing focus or energy. And so I'll do my best to do my small part in the disorder that I'm studying. But I think that there's many opportunities because in parallel, and I should say also relatedly that what can happen is to do more explicit comparisons. So now we have good descriptions of what's happening in individual disorders, explicit comparisons between disorders. I think we have much more to go on. So, for example, comparing what's patterns that we see in depression with those of anxiety disorders, a near neighbor of conditions that are highly comorbid, so co-occur with depression, and understand what's similar, what's different. In terms of how emotion changes in these conditions.
So then when you speak to students who are just thinking now about embarking in this field of emotion, what kind of advice would you give them or have you given them?
Trust your instincts. I mean, I would give them contradictory advice, of course. So that would be to trust their instincts. I mean, I don't think I would have had any success at all if I didn't listen to my instincts initially about crying. So there's something I read in the DSM, and I was like, well, what does that really reflect? What does that really mean? What was that based on? And I learned it wasn't really based on a research study. So I thought, let's do a research study, and one thing led to another. And so a student has an insight like that, even if it's not fully baked, they should act on that. And the contradictory thing is that at the same time, I think you have to be able to integrate feedback from mentors. So, but both things can be true. So you can very much think that you have a good idea, but what the job, and you can stick to your guns. But what a mentor can help you do is shape that idea a little bit and help you see, well, what can I really learn, or what are the limitations, or because I think that science is always this juggling act. Emotion, no different than other areas of science, between being not novel. So having ideas that the field is going to need to assimilate with accommodating to what's already known. And so a good student is going to both be wanting to push the envelope in terms of what we already know, but also finding ways to accommodate what they're finding with what we already know.
Well, thank
you.
And
it never ends. So it does. After you get your PhD and you're on your postdoc, or in your first faculty position, or if you've got tenure, you're a full professor, you're a distinguished professor, it doesn't matter. This predicament will always be true, where you have to develop new ideas, but also understand the context in which those ideas are happening. So graduate school is just the first in some ways most dramatic place in which that process unfolds. And some of it is that many students feel like they don't know anything. But the truth is that even now the field of emotion is a little bit more mature. There's still vast areas where we really don't know too much more than not knowing anything. And so they should feel very confident that they can make a contribution.
Well, thank you so much for speaking with us today, John. It was wonderful.
Oh, it was my pleasure. It was great speaking with you, Jean.
Always good talking to you. So this concludes our Experts in Emotion interview with Dr. Jonathan Rottenberg from the University of South Florida. Thank you again.